Physical inactivity is a major public health problem worldwide. Furthermore, there are significant effects on a neurobiological level. Maria and Veena are from the United Arab Emirates and experts regarding this topic. Stress and physical inactivity are risk factors for many chronic diseases. What is known about neurobiological changes?
So the neurobiological changes of chronic stress on the human system include increased glucocorticoids, which is a response from the HPA axis that we know about. Glucocorticoids are directly responsible for increase in glucose systems, so we will also have problems with insulin resistance and subsequent diabetes, decrease in calcium absorption, which will increase osteoporosis, and increase in triglycerides, particularly for women in cardiovascular disease.
And what's about long-term effects?
So again, the long-term effects will be subsequent. You will see our chronic disease processes like obesity, metabolic syndrome. We will see in certain cancers you will have for chronic stress overload on the system, and also diabetes.
Thank you. So on what kind of activity and training would you recommend and why?
So a lot of different types of activity are recommended. However, what is the common ground for everything is pick an activity that is voluntary, meaning that your client wants to do this activity rather than forcing it upon him. Secondly, choose something that is with social interaction, that is outdoor, and that relates to his context or his environment. As well, choose an activity that incorporates more than one thing, like a dual task or something that adds in more tasks to do, which enhances their executive function. Don't forget that as physiotherapists, we need to add in some relaxation, some visual imagery, breathing, and mindfulness as a standard protocol for all treatment sessions that we do.
So one last question. You are from the United Arab Emirates. What is the status of physical therapists there? For example, do you have direct access?
So at the moment, we do not have direct access, and very frequently in the UAE, physiotherapists work under the physician, the doctor, the physical medicine rehab professionals. However, there are policies, and the Emirates Physiotherapy Society, which we are both members of, is trying hard to advocate for more direct access and autonomy in physiotherapy practice.
So it's similar than in Germany. Thank you very much. So that means there are so many reasons to be physically active, even on a neurobiological level. Thanks for watching PT.